Good afternoon, everyone. I'm Rajapaksha from the Department of Health Promotion, Faculty of Applied Sciences, Rajapaksha University of Sri Lanka. My research topic is response and acceptability of mothers to a health promotion intervention targeting to reduce risks of unintentional home injuries by improving home environment. Let's move on to the introduction part. Injury among children is a preventable and critical public health issue globally. Unintentional injuries account for 0.8 million deaths in children, primarily in low and middle income countries. In Sri Lanka, it is one of the top 5 main causes of morbidities and mortalities among children. The majority of reported injuries occurred in domestic home environments. Therefore, developing a child-safe home environment is important in injury prevention. Let's see why using health promotion intervention to address the issue. Many existing interventions focus on knowledge improvement only. However, health promotion intervention utilizes a collective, participatory, community-based approach which has shown to be effective. In health promotion approach, it facilitates behavioral changes by creating a supportive environment. Community is an active part of the intervention in designing and implementing. The ownership of the process goes into the communities, and therefore the sustainability of this approach is very high. Here you can see the logical framework of the health promotion intervention, and it comprises with 4 steps. The objective of this study is to explore the response and acceptability of mothers towards a health promotion intervention to reduce risks of unintentional home injuries by improving their home environment. Let's move on to the methodology section. The study design used here is the qualitative study design, and the study setting is Missakamavatha village where the intervention study was conducted, which is located in Mihintala MOH area in Anuradhapura district. The study population is mothers of children under 10 years who participated for the health promotion intervention, and the inclusion criteria are mothers with at least 1 child of this age group living in the selected villages and being a part of the health promotion intervention conducted to reduce injuries by improving home environment. Exclusion criteria is mothers of children with special needs, chronic diseases or disabilities. The sampling technique used in this study is purposive sampling, and it is based on the previous knowledge on the same group of mothers, and the sample size is determined upon the reach of data saturation. Data collection was done using focus group discussions, and each of the focus group comprised with 4 to 8 mothers, and each discussions were intended to conduct approximately 45 minutes. The discussions were conducted in Sinhala and audio recorded, and field notes were taken. Data collection continued until reaching saturation. In data analysis, the recorded data were transcribed, translated, and transcripts were read and themes were developed. Codes were used to support the themes. Ethical considerations. Ethical approval was obtained from the Ethics Review Committee of the Faculty of Applied Sciences, Rajapaksha University of Sri Lanka. Administrative clearance was obtained from the Mihintala MOH office. Written informed consent and assent when recruiting participants to the study was obtained. Privacy of the participants was protected by keeping the data anonymous. Confidentiality of data was ensured by data security in retention and access. Let's move on to the results section. 7 focus group discussions were conducted in this study, and the 50 mothers who were being a part of the health promotion intervention was participated. Initially, there were 62 participated for the intervention. Then 3 themes were developed by analyzing data. Let's see what are the key themes identified after analyzing data. Theme 1 is change of knowledge. That means being a part of the intervention, it supported mothers to understand how important the home environment is in reducing injuries among children. One of the mother in the FGD1 mentioned that we knew there were risks of unintentional home injuries, but we did not pay much attention to them before. After joining this program, we realized the importance of reducing these accidents and the harm they can cause to our children. One of the mother in the FGD3 mentioned that collectively as a group we engaged in discussions and increased our knowledge. In fact, by working as a group, we were able to know more about this topic that we did not know. Theme 2 is need to take actions. The intervention had supported mothers to plan and implement actions or activities to address determinants or risk factors leading to unsafe home environment. One of the mother in the FGD2 mentioned that we considered many of the home-related accidents that children experience to be normal. But when we worked as a group, I realized that we can change these things with simple actions, and we understood that we can change many of these accident risks as caregivers of children. Another mother in the FGD4 mentioned that in the past, even if a little water spilled on the floor, it was not taken seriously. But now I think that the child will slip and fall and immediately take a remedy for that risk. Another mother in the FGD7 mentioned that in the past, the little ones used to play with toys that were on the floor, but after I gave them a basket when finished playing and put the toys in it. Theme 3 is stepping to healthy practices. That means mother stated that practices initiated during the intervention had shifted their practices in ensuring a safe home environment and have become a routine practice of them and their families. Mother in the FGD5 stated that as soon as everyone in the family sees the risk of accidents in the house, they take measures to prevent the risk of accidents, so everyone works together to make the house safe. Another mother in the FGD6 mentioned that in the past I used to think that when the toys fell on the floor, I would clean them up later. But after being told by this program to take time for the environment, now I'm always paying attention to the risks in the environment. Let's move on to the conclusions and recommendations. Study findings reveal that it is possible to reduce the risks of unintentional home injuries by primarily targeting on mothers aiming to improve their knowledge, attitudes, and practices. Findings from this study also reveal that mothers have changed their behaviors related or towards children even within a short period of time. This emphasizes that mothers take more efforts and control over the activities those are relevant to child health easily and quickly. Therefore, this observation from this study suggests that focusing mothers in similar interventions to improve child and family health could be more effective. Here are the references. Thank you all for listening to my presentation.